you a little bit about what we've been doing.
Yeah, and this is Anthony. If I could add to that, I mean, Bo and the Prevent Cancer Foundation have been a great partner, and the beauty of what we're doing with this initiative is the Ad Council didn't develop those PSAs, although we've been doing work in that space for years. This initiative allowed the Prevent Cancer Foundation to develop their own PSAs with their own creative and utilize the research and the learnings that we have through this initiative to integrate those consistent messages into their own brand in the way that they felt their mission could be fulfilled. And that's really what we're asking all of the members and partners to do. We've developed a website. You can access it through the Sea Change homepage. There's a little projects button there, and you can go to a Sea Change Projects website where there's a toolkit with a lot of the creative assets that are available to you. There's some PSAs that the former president and Mrs. Bush created for us that can be adopted and adapted for your organization. There are newsletters, little visuals. There's the underlying research that went into the development of the communications. And the other major component to all of this is that we at the Ad Council, myself and my colleagues and Peggy, are all really here to support you and your organization. So it's not about giving you this website and go and figure it out on your own, but rather call upon us whenever you need to via email, a call. We're holding meetings with a number of members collectively or individually to figure out how we can best utilize the communications tools and materials that you already have or that you're planning to integrate and incorporate some of the learning that we've done, so that at the end of the day, we really are delivering this consistent message, one that would enact a few of these programs and initiatives. If there's anyone else that wants to comment or talk about what they're doing.
Hi, good afternoon. I'm Michael Caldwell from Dutchess County, New York. I'm the Commissioner of Health there, and we have really latched on to this initiative with our own comprehensive cancer control program at the local level. And we believe that it is important to have a nationally branded effort that's simple, that's straightforward, and it is something that is easily understandable, something that we all can repeat over and over again and have simple conversations with our community. So we look at this as a tremendous opportunity to take these tools and put them out as part of our comprehensive cancer control effort in Dutchess County, New York. And so we look at us as really just being an instrument to be able to amplify a lot of this great work. And we know that the power in this is going to be in that people will hear these messages hopefully over and over again and throughout the country, and then be able to make those connections to their own lives at those trigger points where they need to make those decisions that will help them to lead a cancer-free life. Thanks, Anthony.
Maureen? Not sure, is this on? Yeah. Peggy, actually, we're taking the message to the street. In Louisiana, we are working on developing a DVD to put in the hands of both women who are adherent, but women who are non-adherent to mammography screening. And the message coming from the Sea Change Communication Initiative will be the foundation of the DVD. And so we will have the DVD both for African American women and then subsequently translated for Hispanic women and for Vietnamese women. We have a sizable Vietnamese population in New Orleans. So thank you for having this as a tool.
Thank you very much.
George Weiner from Iowa. We've incorporated the symbols along with our logo on Frisbees and bags and actually distributed thousands of them at the state fair in Iowa. I don't know if it helped convince people, yes, they look familiar, here they are. I don't know if it led them to avoid eating a fried Twinkie during the state fair, but I have seen them around for months since we distributed them.
Do we have anyone else who wants to weigh in? You know, I see some team members before we find someone else to call on. I want to acknowledge not only Anthony Signorelli and the wonderful leadership that he has done for this initiative, but Gary Gurian, Margaret Marishak, Jean Becker, I see Lynn Hanesian, who was with Edelman and now is with an offshoot of Edelman. I forgot his name, I'm sorry. But anyway, Lynn's been a great partner over the years, as have all the people that we mentioned, and we really, really appreciate the team effort behind this important research that has led to these messaging platforms. Gary, do we have anybody else you want to call on?
Anybody?
Thank you.
I'm Kathy Bennett. Has your group discussed ways to get to college campuses? To Bo's point of start early, don't stop. They smoke, they drink, they do bad exercise, they get in the sun too much, and somehow lessons learned at the earliest possible time are those you hold for the longest period of time.
Anthony, would you like to take that one?
I'll help it answer that. I mean, I think what we're doing is not necessarily identifying the ways to reach people, but working with all of your organizations to reach those audiences. So I guess the question goes back to the group is, do you know of any programs, are your organizations working with college campuses and kids to get these messages out? And what we're providing really is the right message and some of the tools to do that. So we welcome any opportunities. And it sounds like, it looks like Allison's saying there might be something over here.
Hi everybody, Charles Capcella, President Emeritus of the University of North Dakota. And we've actually, in recognition of the truth of what you said, have some years ago embarked on a comprehensive wellness program for our campus. It started with the building of a wellness center, but then quickly evolved into a very comprehensive 7 dimensions of wellness that have to do with nutrition, and it permeates the entire campus. Everything the food service does, all kinds of messages for this college students. I happen to believe personally through that experience that even though it may be only indirectly related to what we care most about here, the problem of binge drinking on campuses perhaps is best addressed in the context of wellness and having students see that the responsible use of alcohol is every bit as important as everything else they might do relative to their health. We also took the additional step of implementing some corporate policy to help encourage students to do the right thing, for example, by establishing a tobacco-free campus, one of the first large campuses in the country to do that. So there's something that's been started there, and I think obviously a lot of work yet to be done. There are probably 4,212 colleges and universities where there's still some work to be done.
And I could actually add to that. We did work closely with University of Nebraska to help them recently. They developed a PSA campaign as part of their sports network in the region around colon cancer prevention, and some of the work that we did and the research that went into the screening message found its way into some of those communications. So again, we're working with folks to help identify some things, but really to support the communications tactics and programs that you already have in market or plan to bring into market.
Good afternoon. I'm Pam Jackson with the Intercultural Cancer Council, and we sponsor a program called the Collegiate Cancer Council. And to answer your question in regards to the college campuses, many of our collegiate cancer councils have embraced many of those initiatives. Many of those initiatives, including we are embarking upon a program with HPV. So there are many college campuses that are involved in those initiatives across the country.
Thank you very much. Well, it looks like we did get a great dialogue going, so thank you very much. And literally, we want you to take us up on the offer that Anthony mentioned earlier. We'd be happy in a consultative way to talk to you, to talk to your communications directors, anyone in your organization that you feel would benefit from a discussion about going through your communications programs and finding ways to embed these important messaging platforms. And we're here to help. So thank you very much, Jim. I'll turn it back over to you.
Actually, I'm going to introduce Phil Wong. Sorry. He's going to be talking about the Making the Business Case program, which is another one of our major initiatives. So, Phil.